Hello, my name is Antje and I've been a patient with Michael since spring 2011, and in 2009 I had a skiing accident. I went skiing down the slope and I fell on my buttocks, and it wasn't painful at that moment, but it was rather painful like the next day when all the muscles had a chance to tighten up, and I didn't really think that I'd injured my coccyx. I rather thought that I had a restricted SI joint, which I had problems with before, so I didn't take it very seriously at that point, although it was quite painful. So after a few days, the extreme muscle tightness that stretched throughout my whole pelvis went away, and but the pain around the coccyx stayed and got really noticeable now because I didn't have the muscle tightness in other areas so much anymore. So it became more and more painful when I sat down, and needless to say, the 6-hour drive home from the skiing resort to where I lived in Germany was really painful. So the next week then I went to my orthopedic doctor, and he didn't really take me very seriously. He didn't even examine me properly. He offered me some acupuncture, which I did for a few weeks, but that was just in the general area and it didn't do me any good at that point of time. So because I'm a very active horse rider, I also continued horse riding during these first few weeks after the injury, which was extremely painful, of course, but I just thought I can kind of toughen it out because I still thought that it was just a bruise and that it's nothing serious and that it will go away on its own, which it didn't. So after several months, I think that was, when I eventually had given up on horse riding, I changed my orthopedic doctor and I went to a different one, and he then finally took some x-rays, which was not an easy thing. I think they tried 2 or 3 times to take the x-rays, and finally they managed to get at least 3/4 of the coccyx on the x-ray, but not the whole coccyx. He also sent me to have an MRI done, which then showed more, but which also just about had the coccyx on it, but that was fine. So when I had these images taken, the interpretations were very varied. The radiographer said it was everything normal with the coccyx, and if anything, what she can see on the picture was just a congenital variant, but that didn't really explain why all of a sudden I had pain in that area. So that was a bit of a strange theory in my opinion. Then the orthopedic doctor himself, he said that it's probably broken, and he prescribed me a ring pillow, which helped my sitting, but which didn't really do anything in terms of helping me heal or helping me get rid of the pain at that stage. So there was a long time where I couldn't find anything that helped me. I mean, the ring pillow helped some. It helped me sitting, but it didn't really help the cause of the problem. So the coccyx pain continued to be really bad. So finally I decided to take matters into my own hand and search online for a solution for the pain. And so I found this website, coccyx.org, and on there was a discussion forum, and in this discussion forum there were many recommendations for Dr. Michael Dörtner, and yeah, so I decided to give it a try. Also, I myself started studying chiropractic in autumn 2010, and so because Michael obviously is in London, I had a better chance now to go and see him. So when I finally went and saw Michael, I showed him my x-rays and I showed him my MRI scan, and on that he could very clearly see that the middle segment of my coccyx was slightly displaced, and on palpation he could also feel that it didn't, so to speak, fold under when I was sitting, so it was restricted in its movement. So that's why it was so very painful for me to sit down. So because it had now been, I think, almost 2 years since I had the accident, he warned me from the beginning that probably it's going to take some time for the coccyx to heal again. So we started treatment in that spring of 2011, and after a couple of treatments already, I could feel improvement. It was slow, but it was steady. I could sit for longer periods of time, and I didn't get that stabbing pain anymore when I went up from the sitting position. It was, as Michael predicted, a slow recovery, and I had some setbacks, and sometimes I doubted. But in the end, over a long period of time, I could see a definite improvement. Today, I would say I'm about 90 to 95% better. And I even started horse riding again. I think that was a year ago when I started. At first, the horse riding made things a little bit worse again. But then Michael reassured me to continue, and now I feel that it actually helps me to mobilize the coccyx again, and it helps me to get that last 10% or 5% back that I need to be 100%. And I start in competitions, and I do really intensive training, and I'm so happy that I can do that again. Because of this personal experience that I've had with coccyx pain and chiropractic, my belief is strengthened that I'm studying the right thing, and that chiropractic can help you in so many ways. And but I have to say that even at the college where I study here in Bournemouth, that the treatment of the coccyx is not taught there, or it is mentioned sometimes, but then people are embarrassed to talk about it, or maybe also to teach it, so it's not done. But they don't have that personal experience. They don't know how miserable you can be when you have coccyx pain, and how desperately it needs to be treated, and how desperate people can be to find somebody who's actually capable of treating it. So I hope that before I go back to Germany to work in my own clinic when I graduate, that I can learn from Michael how to treat people in coccyx pain, and that then I can help German people with it.